This is episode 191 of the Rio Grande Foundation's Tipping Point, New Mexico podcast. I'm Paul Gessing, president of the Rio Grande Foundation, New Mexico's free market think tank. You can find out more about the foundation at riograndefoundation.org. I am very pleased to be joined this week by Lisa Shin. She is an optometrist based in Los Alamos, New Mexico, who also happens to be on the board of the Rio Grande Foundation. Welcome to Tipping Point, New Mexico, Lisa.
Thanks so much for having me, Paul.
Yeah, well, it's a good time to talk in some respects because your business is shut down, and we'll talk about that in a little bit. But in general, Los Alamos is such a unique community. And before we get to talking about New Mexico, its economy, share with us what the vibe is like in Los Alamos. In that sensitive town with all the security issues, are people working as they normally do? Are they somehow working at home? What's going on in Los Alamos during the coronavirus pandemic?
Right. Well, there are some people who have to go into the lab to work because the things that they're working on with the national security but I know that there are many employees that are working at home. So the lab made a way for the employees to work from home. I mean, I think many of them have laptops and they're just doing a lot of their operations at home.
And of course, Los Alamos is a very government intensive place, even relative to the state of New Mexico. I can't imagine there's too many of those highly paid lab workers that are laid off these days, but still some impacts filtering through the local economy up there, I'm sure.
Well, the small business community has been, shattered. I mean, you drive down the street and everything's closed. I know there are some restaurants that are offering curbside pickup, but it's certainly not enough.
No doubt about it.
Yeah. And it's
we
very
will,
quiet. Yes, very
sure.
quiet.
Even for normal, which Los Alamos tends to be sort of a quiet and reserved town for a lot of the reasons that we all know about that particular city. Well, again, before we get into your specific business, you've been on the Rio Grande Foundation's board for a few years now, and you've been active in politics in the state. You ran for the legislature, but something you did that I think is one of the most exciting and interesting things maybe of your life experiences outside of getting married and having kids. Want to make sure that they get put up first, but you spoke at the Republican convention when President Trump was nominated. Talk a little bit about that.
Yeah. So you're right, Paul. This was a once in a lifetime, never happen again moment, where I got to speak at the Republican National Convention. And I got to speak on July 21st, which was actually the day that Donald Trump spoke. And it was just such an amazing, surreal experience, to be there I was in the back room with all these, experienced politicians and leaders of the country. And I was back there, and it was just really amazing that me, with no background in politics or government, would be asked to speak and have this opportunity. And basically, I spoke about the immigrant story, and it's every immigrant story of the American dream and the beauty of the American dream, and why our parents came here. Why? Because they envisioned a better future for their kids, for freedom, for liberty, opportunity, prosperity. And, I saw the country moving towards socialism. And it really terrified me. And I thought, I've got to get involved and I have to do my part. And, it was pretty amazing, amazing that I got to do that. And
Yeah. Well, how did that conversation take place? I mean, you're an optometrist doing business in a relatively small town here in Blue, New Mexico. you know, you're not somebody who had been involved in
Right.
politics in any way that crossed my radar screen. And, I don't know everybody in New Mexico who's doing work at the local level, but you weren't on my personal radar screen at the time. And then suddenly there you are on all the major networks, and you're giving a speech
Right.
on
Well,
in a very prominent role.
right. Well, I do think that the Trump campaign, they were very aggressively seeking out people like me, like a minority voice, because
You're Korean
you know,
American, correct?
right, I'm Korean American, and I support Trump, and you heard all the outcries. Trump is a racist, he's xenophobic, he's anti-immigrant, and here I support Donald Trump. And I think they were looking for people like me. And I got kind of plugged into groups that were like-minded people. And I think they somehow they found me and
Now,
and they
did you get
called
to
me.
meet the president, who then was a candidate, of course? Were you able to get a minute to at least shake his hand?
I did not at this convention. I regret that. I had a handful of opportunities to meet with him, but I just the timing, I never got that chance.
Yeah, fair enough. That's
Yeah,
a
yeah.
lot of people speaking at a convention, and I'm sure he's busy and he's not around all the time. So I'm going to, turn the conversation. Obviously, you're in the pro-Trump camp. We're dealing with this global pandemic. We've got a combination of governors, other state and local policymakers acting. We've got the president of the United States making important decisions. We've got world leaders all over the place making their own decisions. How do you think the president is doing in this entire situation?
Right. Well, I think he's done an outstanding job. He just came out with his phased approach to reopen America, and I support it 100%. It makes a lot of sense to me to slowly, start moving towards, getting back to our robust and healthy economy and getting people working again. It's very important.
So it's safe to say you would be in the let's get things back opening as we record this on April the 20th, just so people in the future can go back and know where we are at this point in history. So you're, just to be clear, you're in the start to reopen America as you
Absolutely.
believe prudently based on the president's recommendations and those of health experts. Sooner,
Right. It's a phased approach. A
right?
phased approach, yes.
Okay. Well, that does lead us directly to your own business and talking a little bit about that. And we can certainly talk more broadly about New Mexico and different issues taking place around our community. By the way, do you know offhand how many folks in Los Alamos have uh, the coronavirus? It tends to be a pretty
I believe
isolated
I
incident.
thought I saw like 5 or 6.
And those are people who had it. Anyone die of the illness yet, or?
I don't believe that there's any deaths in Los Alamos,
And
but I
pretty
do.
healthy community, highly educated. They were just noted by whoever's tracking this of being the highest by far area in our state in terms of replying to the census. That's no surprise. Los Alamos is kind of on the ball about a lot of things. Highly educated folks, so it's no surprise that they're returning their census forms like they would do everything else.
Right.
Yep. So when you talk about your business, so as I said, you're an optometrist, and uh, you know, there is at least some business out there that can do some optometry services uh, from a remote position. But kind of talk about what your day looks like as an optometrist typically, and how what is happening at the state level in terms of the shutdown has affected you.
Right. Right. Well, I've been in practice for 23 years, and I'm pretty much what we call full scope optometry. I do eye exams. I do more medically oriented eye care as well. I do glasses, lots of glasses sales, and we also provide contact lenses. And so normally, I have a very busy practice with, lots of appointments every day and kind of crazy. Actually, from the beginning of the year, it's been crazy busy. And so um, on March 23rd, the governor came out with a list of essential businesses. And these are the ones that are okay to be open. And, I was encouraged because I was kind of on that list because she mentioned walk in health clinics. But then 2 days later, she banned all non urgent, non essential medical care, only life threatening and emergency. And I had 3 days to submit a report to the governor that kind of gave a list of all my essential and non essential procedures. And by the way, there's a phone number for citizens to report non-compliance to the police. And by the way, if you don't comply, you get a $5,000 fine and maybe you lose your license to practice.
Wow.
And, at first I kind of thought I could stay open and, because there was like a couple days there, where it was just me. So my colleagues were astonished because I told them it was just me. I was the receptionist. I was doing the eye exams. I was selling glasses. I was taking measurements. I was taking payments. I was like doing everything. And I thought, I can do this. I can have a very limited schedule and kind of see patients like kind of on a one per hour basis. But then I heard reports of police being reported or people reporting eye care practice to the police. And I know that Stanton Optical in Albuquerque was visited by the police. And so, I thought at that point, it's probably best that I just go ahead and shut down and not risk that. And, the thing that,
Let me jump in there real quick
yeah,
because you talked about a lot, and
yeah,
I am blessed, but in this case cursed because I've always had really good eyes. I only have had glasses for reading, so close distance reading in dim light. It's sometimes a challenge for me. So I'm not that familiar with all the different aspects of optometry. If people are not able to get your services, what are some of the ramifications? I know, every doctor, every physical treatment that we have has, some important aspect to it. It's not always life or death, but certainly being able to see or see better is relevant. I mean, what kind of treatments are you not able to do right now that you think are especially important to the people who would otherwise be in your office?
right. Great questions, Paul. And, I routine eye care is essential. And why is that? Because, I do a routine eye exam. Patient has no complaints, no problems, nothing's wrong. But guess what? I dilate their eyes and I see diabetic retinopathy. They have serious diabetes that needs immediate intervention. Or, you know, no symptoms, no complaints. Patient has a pituitary tumor that's impinging on their optic nerve. They have peripheral vision loss that they were unaware of. That needs immediate surgery. That's routine. No complaints. I didn't know that was a problem. I didn't know the person had a problem. I've seen people that come in for routine eye exams that have like a vein occlusion. They had no idea they had a vein occlusion. I've got to get them in to see their internist right away. And so, I
Occlusion
really,
means blockage, I take it. I'm
yeah,
trying to
exactly.
get
A
through
vein
some of the
occlusion.
medical jargon here for
Right.
our
I'm sorry. Yeah, it's a vein
okay.
occlusion, which puts them at serious risk for a stroke.
Right. Yeah.
They
The
have to
eyes are
see
very
that.
important as a indicator for a lot of health issues, and that's one of the
Right.
aspects of your work, huh?
So, I'm very concerned about, we shut down routine healthcare, elective healthcare, but it's all essential. It's all important. So my question is, what happens when there's no one to provide the healthcare that you need? One, and two, in saving one life, are we losing 10? I mean, I'm just really objecting to this, shutdown of non-essential eye care and healthcare, and I really think the first thing that Trump wants to do, phase one, is he wants to open up elective surgery again and get our hospitals, staffed again because, we can't have all these hospitals that are shutting down and putting their employees on furloughs. We just can't have that because that has a devastating impact on healthcare.
Yeah, and just to kind of reiterate, a number of hospitals all over the state and all over the country have announced furloughs of people who may not be involved in treating COVID-19 patients, maybe doing knee replacements or optometry or some other medical procedures. Uh, but because of various orders that have been imposed at the state level predominantly, they are unable to treat. And of course, and maybe you could describe some of the financial ins and outs here. Uh,
Right.
what you get is a lot of people who pay for elective surgeries and elective procedures. Those are the money makers for a lot of medical providers. You don't have the ability to get uh, your bottom line in from treating Medicaid patients or Medicare patients or whoever. Uh, can you talk a little bit about that as you see it, or maybe as you?
Oh yeah, it's huge. I looked at the numbers for just optometry, and optometry is like a very small percentage of the total. But um, for 6 weeks of optometric care, not being able to operate, we're talking about 8 million lost in revenues.
For your
And for
business
for my profession, for optometry.
in the nation or in the state?
No, just the state, just New Mexico.
And by the way, I want to clarify something because it's important for the state's bottom line, as we're going to see a huge crisis here in the state budget, especially as we record this. Oil prices are actually negative for the first time in any of our lifetimes. Where is New Mexico going to get money? Well, medical procedures a lot of times are taxed. Can you talk about that under the gross receipts tax? So you're
Right, right. So I looked at this too because you were going to ask me about this, Paul. And optometry as a profession, we're paying about 500,000 in 6 weeks, and so the state has lost out on those revenues. Not to mention state taxes. So if an optometric practice loses their gross and net income, that's less state income taxes that are paid as well. So it's, the impact on the state budget is staggering. I mean, we're talking about um we're facing a huge deficit, and I don't think we've even begun to consider how much that's going to really be. And one thing that I think is going to have an impact up here is, as we're looking at a $5 to $6 trillion deficit in the federal government because of COVID-19, we might see an impact on Lanol GRTs. I mean, Los Alamos is always talking about those Lanol GRTs, and I think that is going to have an impact. I really do. I mean, I think
yeah.
yeah, every sector is going to be have a negative impact
At
because of
some
this.
point, the federal debt situation is going to get to a point where something is either going to have to be done with it, or the international investor community is going to do something about it and send us into some kind of budget crisis. I'm a big fan of Stein's law. It's Ben Stein, the guy from the movies. His father Herb, who said that something that can't go on forever won't go on forever,
Mhm.
and you can't just pile up the kind of debt that we're talking about at the federal level and keep on going. And New Mexico for sure needs to do something to get back on its feet financially, economically. I mean, if I never thought in my life, I never even contemplated the idea that oil prices would be negative, but and
Mm.
hopefully it doesn't last for very long, but it's not going to rebound to anything significant. The point is that New Mexico would be in a special session very soon just to deal with this kind of oil price collapse by itself.
Mm.
The fact that so much of the rest of our economy is frozen and not paying taxes and not contributing to what we have is just the further indicator of where we are. So real quick before I want to talk about your practice and safe practices potentially with the coronavirus, but um, what's going on, with your employees? Are you trying to pay them? And I know this is a sensitive topic, but are you able to keep them on, or are you going to have to let them file unemployment? Because, if you were able to treat people, then they would be paying into the system, paying taxes, not just yourself, but the receptionist and the other folks who you hire. Uh, what's going on with your employees and stuff?
Right, right. And there's been different responses across the nation and in our state with optometrists. I mean, I've heard my one colleague in Taos, all of her employees are on unemployment. I have other colleagues who are trying to keep their employees, and they've applied for the paycheck protection plan loan. Now that program is running out of money, but I've seen different responses. For me, I was able, thankfully, to keep most of my employees on payroll with reduced hours. So thankfully, I was able to do that because, I really didn't want to put anyone on unemployment. I really didn't. I wanted to, keep them on, cut back hours. So, if I had an employee maybe working 40 hours, maybe we'll do like 30 hours. Maybe we'll cut back. And we've been working it out.
And
But
that's
it's
very admirable, but I mean,
yeah.
you can't do that forever. And I don't need an exact time, but like, you know, how how far out into the future do you think you can kind of keep that situation going, or
Well,
that's
I
something you don't
mean,
want
Paul, I'm just really hoping that we can open up soon
to? And
because, obviously you can't keep going with that model, you
that's
know?
fair enough. I certainly don't want to put you or your employees in a tough spot, but
Right.
yeah, it needs to be something that has a date certain uh, you know, kind of conclusion here, or at least an understanding of when we can go forward. And so that's what I want to talk to you a little bit about now, Lisa. The optometry business is certainly a business that has a certain amount of personal contact. I don't know how you've looked at it and what you think, but how would you reopen your business using something along the lines of current social distancing practices, 6 feet away?
Right.
Were you looking at masks for those kinds of uh, interactions with patients? Walk me through, um,
Right.
understanding that I am not a medical professional. And my listeners are not generally medical professionals, and we're all trying to figure this out in this brave new world of the COVID virus and getting beyond it, though.
Right. So I have a plan, Paul, and I'm really excited about my plan because I think it's safe and it's responsible, but it keeps me going and it keeps me moving forward. And so one thing I want to do is I want to limit the number of staff and patients in my office. So that means I would have to really look at my schedule and scale it back, of course. I mean, if I'm used to seeing, 20 patients a day, it's going to have to be like 10 or maybe 8. I've got to limit the number of people that are in my office. And normally we would have a lot of walk-ins, we have a lot of pickups. People don't really call, they just walk in during our office hours. But I would have to cut back and say, appointments only. Like you can't just walk in, you have to schedule something with us. I want to get rid of my waiting room because, I don't want people sitting around close to each other. I'm going to have to get rid of it.
And just to be clear, though, I mean, people at a waiting room in an optometry practice tend to be fairly healthy folks. We're not
Right.
talking about people who have compromised immune system to begin with, or they're not there potentially for a COVID-19 sickness
Right.
at that point in time.
Well, I think
Well, that's still
this
prudent. I'm not questioning. I'm
right.
taking it.
Yeah, I looked at it and I thought this would be a would be a good way for me to make my case for safety, doing everything I can, wait in the car for your appointment, frequent disinfection and cleaning between patients. And I just bought, I'm really excited about this. I bought a new thermometer. It's like a touchless thermometer where you scan their forehead
Mhm.
and you can tell if they have a fever. And if they do have a fever, then you're not going to be allowed in my office. And
Right.
if you want to come into my office, you better wash your hands. So,
Right. Well,
yeah.
I will say that early on in the crisis, I had some good friends who they're young and married, but no kids, and they were in Singapore as this whole situation was kind of getting ramped up. And that's what they said was done in
Mhm.
Singapore. They had private security essentially. It's kind of as New Mexicans, we can appreciate this. You go into an isotope stadium, for a baseball game, and you have to go through a metal detector. Well, instead of a metal detector, they were standing there wanding you with a thermometer to make sure
Mhm.
that you didn't have a fever, and if you did, then they would send you to essentially an unoccupied room where you could wait for further testing, and then they would work on that. But it's I think you're spot on there in terms of asking everybody to get their temperature taken before they come into your office.
Right. And it's interesting. I've been doing some virtual eye care, Paul, and I know it's interesting because optometry has always been very suspicious of anything online, remote eye care, telemedicine, forget it. And now we're kind of forced to embrace it.
Right.
And I've really enjoyed actually the handful of visits that I've had where I get to chat and I get to kind of see their eye. What does that look like? Does it look like an infection? Do they need antibiotics? And it's actually it's kind of opened up a new world for me, because to be honest, I don't know that I would have ever um, embraced it the way I have had it not been for COVID-19.
We'll talk about that a little bit for a minute. Of course, I have children, and I'm also on the board of a virtual charter school, K-12 charter. Well, actually, it's 3 to 12 charter school here in New Mexico, and we went through a lot of difficulties with regard to getting this school authorized because of opposition to virtual learning. And now they continue to teach kids every single day, whereas the public schools and the school my kids go to is not going forward. So, how do you physically do these virtual appointments? Is there special software? Are you just going with a Skype or Zoom or whatever kind of call? And what can you, without getting too technical, procedures can you do and not do in a virtual setting? What are the
Right,
limitations
right.
maybe at this point?
Well, I mean, the way a virtual eye care, it really works best when it's an established patient. So it works well, Paul, when I know the patient, there's a history, I have their records, I know the patient and I've seen them before. I mean, that's really the most ideal situation, because you really, if you don't have that history, you're really not practicing at the level of care, the standard of care, because all standard of care requires kind of a history and a patient record, and I need a list of all their medications and list of everything that they've had. It's basically, it's kind of like a Zoom chat like this, and I get to talk to them, and I know I've had a couple cases where they kind of showed me their eye. They're like, Dr. Shin, look at my eye, and this is what's going on. And I was able to kind of see it. And for a lot of things that are not very serious, I kind of know what to do.
Mhm.
you know I know exactly what I need to do for that situation. um I think prescriptions, it's a little bit harder to come up with like an eyeglass prescription, because I really need a visual acuity chart, and that's really hard to do remotely.
Yeah.
um, but there's a lot of things I can do. Just talking to people, I can really get a sense of what they need and what would be the best for them.
Nice. Well, it's something that there's going to be some innovation pushed by this whole situation and this increased reliance on virtual technologies and uh, you know uh, just to kind of clear the air, we at the Rio Grande Foundation uh, had some concerns a few years ago, and I don't even remember at this point what happened, but there's uh, when you get into these virtual treatment situations, uh, professional bodies, regulatory bodies, licensing boards tend to get very up in arms, and they run to the legislature to say, no, you can't do this kind of thing, no virtual online treatments. And it runs the gamut really in a lot of different areas, including K-12 education. Uh, what is the state of play in New Mexico, as you recall? Do you know offhand, when it comes to optometry, how uh, the virtual procedures are regulated, or are they prohibited? Where are we at here in that?
Well, specifically, online refractions are not allowed in this state.
What's a refraction?
What that means, Paul, is someone, I need a new prescription for my contact lenses.
Okay,
And, it's very difficult to do that because you're not really evaluating the health of the cornea, and there's some risk there. And so it's not really optimal, to be honest. And I don't know that it really um, is significant. I've not had many patients say, I really want that online,
sure.
refraction. I mean, most people, they come see me, they want to see me, they want a full eye exam, they want care. And so I don't know that that's an issue. But one thing I hear you on the resistance to remote learning and remote healthcare, because you know there's so many online offerings for continuing education here in New Mexico. And for the COVID, I was not able to do the in-person continuing education because of all this, and we had our conference canceled. And some of us have been writing the board of optometry, and saying, hey, listen, open it up so that we can get our credits online. Let all the online count. And there's been strong resistance to that. I mean, it's like they won't open it up, and it's really too bad because my friend in Nebraska, they're allowing it. Texas is allowing it. All the surrounding states are allowing it except us. It's like, oh my goodness.
Just to get back, you had outlined a list of procedures or requirements essentially that you wanted to have in place. Did we adequately cover all those? Because I thought there might be a few. I know you said everybody was going to wear a mask, and that's one of the critical aspects. Curbside delivery, talk about
Right.
the mask issue. I'm not a medical professional. I know that's not your bailiwick, so to speak, but uh, what kind of masks have you heard are effective? And
Right.
anyone with a mask, a bandana in front of their face is able to get through? Kind of talk about that.
I think that my sense is that any mask is better than no mask. And I really think that everyone should be wearing one, to be honest. I think it's important. I think I'm just amazed at how many people are not wearing one when they go out in public. But, my recommendations to the governor, I really think that the governor needs to allow counties to make decisions that are specific to their own communities. What works for Farmington doesn't work in Los Alamos and work in Las Cruces. I think that we ought to allow all businesses to operate at least 20 to 25% capacity, then slowly build up. I do think that the current system is one has winners and losers. There's really no rhyme or reason to what the governor has labeled essential and non-essential. There's no medical reason for it. I
Science-based reason, I believe, would
Yeah.
be a good way, because we constantly hear from the left that they are the defenders of science. They are the ones who
Yeah.
believe that anyone who is on the conservative free market side. Not only are we ascientific, but to quote the governor's press secretary, we're part of a death cult. I don't know if you were aware of that, Lisa. So what you're talking about though is a combination, I think, of some broad guidelines from government officials to say, here's how we're going to do things moving forward, and that businesses need to adhere to them, and that businesses themselves can and should innovate and create solutions that work for themselves and their customers. I mean, I can't imagine anybody walking into your office expecting to get in without at least some of the procedures that you're talking about in place. And I don't think you're by any means alone in terms of uh, businesses that want to do those kinds of things, but need to get in the business to do them.
Yep. I think healthcare providers, hospitals, and, small business owners are all well positioned to, control traffic. We can make appointments, we can stick to that schedule. I really think we ought to adopt a targeted quarantine for those people who are most vulnerable. And we know for that those with immunocompromised conditions, we know those with serious health problems are more vulnerable. And I think, yes, they ought to stay home and they shouldn't go anywhere. I really think we need policies that incentivize employers to keep their employees. Telework. And in Texas, I know they're opening up today. It's amazing. The governor just said, you know what, we're ready to go. And he was proposing a retail to go model where every retail store has the means to provide everything that they do to go.
Interesting.
So I thought that was a great idea. And I just think, putting people on unemployment, it's just that's going to be a real problem for this state. I think that if already we had a higher unemployment rate than surrounding states. And if we start putting more people on unemployment, Paul, we're not going to see a middle class anymore. We're going to force more families and children into poverty. And, what happens when New Mexico becomes a third world country?
Yeah.
That's the question I have. I mean, this is very serious, and that you've said the Rio Grande Foundation has been wonderful with the research backing the fact that educational and health outcomes are better in states with a stronger economy. Colorado spends less money per pupil on education, on healthcare. They have better outcomes. Why? They're wealthier.
Yeah.
I mean, I'm very concerned about this, and
Well, certainly,
it really, really concerns me a lot.
I think that we all are very concerned. I mean, I'm somebody that uh, thinks a lot about the most important issues facing New Mexico. And when you're talking about a single industry, a single product, essentially, that supports 40% of our state spending in that industry, I mean, I'm not going to say that oil and gas won't exist in some way, shape, or form in our state down the road. But until certainly as a baseline, the economy gets going again and is essentially outside of the harshest coronavirus shutdowns that we've seen, that is the baseline. But you know, I was predicting problems in the oil and gas patch long before uh, the coronavirus hit, because there had been a imbalance in the price of a barrel of oil, and then so we got that trade war with the Russians and the Saudis really pushing things down. But I mean, this state really is an oil and gas dependent state. I mean, Los Alamos is unique because you have the federal government. We have that in Albuquerque as well to an extent, but you can't hitch your wagon, so to speak, to a federal government that's seemingly heading towards $30 trillion in debt. I mean, I don't know where that whole situation winds up, but we're rapidly growing that debt, and something's got to give on that.
Mm.
But any last words before we shut her down for this interview? I really appreciate your time Dr. Shin, and really great information, specific ideas, plans for moving, of course, medical providers along. You think they should be providing uh, surgery like knee replacements and that kind of thing? Is that something that
Absolutely.
you said?
Let's do it. I mean, I think this elective healthcare, it needs to be allowed immediately. I mean, this has a really big impact. When you don't do some of these elective surgeries, the situation gets worse and it becomes a much more risky and much more serious surgery later. So we've
Do you
just got to
have plenty of masks on hand at your office, or is that something you'd have to go and get if and when the time came that you're able to open up?
I've got masks. I don't have masks for every single person that comes in, but
Right,
I do have masks for me and for me and my staff.
right. Yeah, and you would have to have people walking in the door who are prepared with their own masks. And
That's right.
all right, well, any last words? Did you
No.
have?
I'm really honored to be a part of the Rio Grande Foundation. I really support the work that you do. It's been tremendous. I think you're leading the way for more liberty, prosperity, freedom for New Mexicans. So,
Well, thank you so much. And I guess if somebody is listening and they are in Los Alamos, or maybe they want to go to Los Alamos to support a liberty-oriented business and get their eyes
come
checked,
see
how do
me.
they find out
Come
more
see
about your
me in
practice?
DC. Um, well, my phone number is 662-9681, and of course, I love taking care of people and their vision and their eye care needs. So, I would love to help you out. If you have any questions or concerns, definitely contact me.
Well,
So,
thank you, Dr. Shin. And I will note that this is the 20th anniversary of the Rio Grande Foundation. So we're having 2020 vision in
oh
2020.
wow.
I know,
Yay.
very, very punny, but yeah, 20th anniversary hasn't gone to plan so far for the Rio Grande Foundation, but I do agree with you. Our work is more necessary and essential to this state than it's probably ever been in the 20 years of existence for the foundation. And thanks for being a part of the board and everything that you're doing for the foundation and the community that you're a part of up there in Los Alamos. So thank you for listening to this week's podcast. Make sure to get the latest edition of Tipping Point New Mexico by subscribing at Apple Podcasts, Stitcher, and Spotify. You can post or comment on this and other episodes on Facebook and Twitter, and tell Google Home to play Tipping Point New Mexico. Thanks to Path 3 Marketing for producing this show.